We go again. Well, good morning, everyone. Welcome to the SIRC Health Equity Lecture Series. Today we have Dr. Jose-Benito Rosales Chavez, who is an assistant professor at the School of Geographical Sciences and Urban Planning. He is a behavioral scientist with a background in anthropology, nutrition, and global health. Dr. Rosales Chavez's topic of interest intersects with community development, social justice, and health. More specifically, he studies the food environment, access to food, dietary intake, health outcomes, and social determinants of health. And today, Dr. Rosales Chavez will be speaking to us about the impact of street food businesses on food accessibility and diet-related health outcomes, a systematic review. So please help me welcome Dr. Rosales Chavez.
All right, let me move this. Yeah, so thank you so much, Stephanie. It's a privilege to be here, and thank you everybody in SIRC for your time. We want to come to the presentation, and today I need to switch the screens. Hold on. All right. Looking at the screen at the actual presentation?
Yes.
All right, so perfect. So yeah, so today I'm going to be presenting some of my ongoing work on street food stands, businesses, and the food that's available there. So thank you for the introduction. I would like to next introduce or acknowledge some of my collaborators in Mexico City, Dr. Luis Ortiz Hernandez and his assistant, Mariana Romo Aviles. They are both in Mexico City at the Universidad Autónoma Metropolitana, the Xochimilco campus. And this is a collaboration that we have going for several years now. It's actually recently formalized through ASU and the Provost and the Board of Regents. So it's something good in case any of you are interested in extending some of those collaborations in fields and studies in places like Mexico City. And so part of what I do, I focus on the food environment. So the food environment has different layers and levels and factors, and that refers to first the distribution of food venues. So where are they? Where are they in the city? Where are they in relation to our homes or work sites? Proximity to the venues, how far do we live from them? Our schools or work sites, how far they're from some of these food venues. The physical presence of food venues, a specific type of venues. For instance, if you think about supermarkets, are there any supermarkets in the community? What other type of food venues there are? And then the connected systems allow access to food venues. And this is we can think about, for example, policies at the national, state, and local governments, and how that impact whether people have access to foods and how easily they can access food. And the reasons to study food venues, well, first, we know from the previous studies that the type of food venue that is in our community matters a lot, because it can be related to the type of food availability that we encounter there and the dietary patterns and health outcomes that we can see from that interaction. So we know that things such as supermarkets and convenience stores, they tend to be characterized as the places where we can buy more healthy, nutritious food. But we also know that some of these places can also have aisles and aisles of highly processed, ultra-processed food items that are not so healthy for us. We know that places such as convenience stores, fast food restaurants, they are typically a source of ultra-processed food items that tend to be linked to negative health outcomes such as chronic diseases and others. But one of the limitations that we can see with the food environment studies is that many of them, if not most of them, are focused on high-income countries, primarily in the United States, European countries, Australia, New Zealand. And within those studies, there are missing culturally relevant food venues, things such as what I'm going to talk about, street food stands. And what do we consider traditional food sources? In a place like the United States, we can think about supermarkets, convenience store restaurants, and these are typically food venues that are accessed by middle-income families, households. But in places like Mexico, where I'm from, we have more than that. I grew up in Mexico, moved to the United States when I was 14. We have a very rich food environment with different other type of foods that we consider traditional. We have things such as Cocina Económica, which is a small family-owned restaurant. In some cases, it's not even a restaurant. It could be someone's house that they open up, especially at nighttime, and they put out tables, chairs, and they cook inside, and then they just customers sit outside and they're serving food. They're typically quite cheap, affordable for their families. We have other things like fruterias. You can find fruits and vegetables that you can take home for processing. We have things such as tortillerias, tortilla store where you can buy very fresh tortillas for your tacos. Then we have carnicerias, with a meat shop. We have things like abarrotes or tienditas. The closest equivalent to this is a convenience store, but these are also family owned. If you're interested in this type of stores, there's a paper called The Coca-Colonization of the Yucatan Peninsula, where they talk about how some corporations try to put as many of these little shops in neighborhoods or streets, so families are within a hand's reach of some other items that they're selling. Again, in this type of business, a lot of the things that you can find are ultra-processed food items. Then we have things like what I'm going to focus on: food stands, food trucks too. I didn't put a picture here because most of us are probably familiar with food trucks in the United States. Then we have depositos, like in this picture, or a bodega type of thing where they sell items in bulk. We have international fast food chain restaurants as well. Although some of these restaurants, even though in the United States they're considered sources of cheap food, in the context of places like Mexico, they actually tend to be expensive. Not families from low income, even middle income backgrounds can really buy there because it's more expensive than food that you might find in other places like a food stand. We have things like mercados. These are indoor markets where you can find a lot of different goods, cooked foods, foods that have to be taken home processing, among other items. And then we have tianguis, which are street markets. It's a collaboration of a large number of individual food stands that come together to sell some of those goods. My presentation is going to focus on street foods and street food stands. For those of you who do not know what street foods are, the United Nations defines street foods as ready-to-eat foods and beverages that are prepared and or sold by vendors on the streets, and they can use a number of different mediums, including highly mobile venues or stands, like this tricycle that you can see on the left, this push car, this other kind of like a wheelbarrow type of vehicle. Then some more semi-permanent. There's a case of people who set up their tables and little chairs on the sidewalk, and they show up in the morning at different times of the day, and as soon as their food is done, they take off. So if you are not familiar with some of those vendors, you may be walking that street segment at a different time of the day, and I even realized that there was a street vendor there at a different time earlier. This here is a person selling tamales and atole. They typically set up shop between 6 a.m. to 8 a.m. and for people who are moving to the work site or school. So if you come anytime after that time point, like breakfast time, you might not find them at all. Then some of the more permanent, and by permanent, it's a loose term because these metal stands in the bottom with a torta sign, those are always fixed in that location, but they can be moved at any moment of notice. They're not brick and wall businesses that are always that can be removed. And this is the definition the United Nations uses and that I use for my studies, but other researchers have expanded the definition because you can also think about products that are highly processed and are mass produced in factories, such as chips, sugar sweetened beverages. Those are items that you can also find and on the street, and they're also ready to eat. And those are mostly part of the stand and where you can find a lot of these type of food items. I do have to talk about the complex nature of street food businesses and street foods. On the one side, researchers like myself, we think that street foods are an urban necessity. It's a primarily thing that you only see or primarily see in urban settings, not so much in rural settings, although they exist. There's a high prevalence in urban settings. And they're urban necessity because they're a source of food security for millions of people across the globe that depend on these foods on this type of businesses for food. These are individuals from marginalized communities who maybe don't have enough resources to buy or purchase or process food. And by resources, I don't mean just economic resources. I'm also thinking about, do they even have water to boil the beans or rice? Do they have the fuel, electricity or gas to be able to cook the food? Do they have pans and pots? Do they have the knowledge to know how to cook healthy food, nutritious food? There are also a source of job security for hundreds of thousands of people who use this as a labor, a source of income. Again, marginalized communities who for one reason or the other, could not have access to government jobs or corporation jobs, they find themselves participating in this type of businesses or economy to generate their income and be self-dependent. Often we see women, younger children in some cases, we see indigenous communities, we see people with low education backgrounds who are actively engaged in this. Although nowadays you're starting to see that some other type of individuals from other socioeconomic backgrounds are also participating because they see the potential, the income that it generates. In some cases, street food businesses can generate more money than if you were to work for some of the local or state governments. So it's a great opportunity to participate in the economy and be your own boss. Another thing with the street foods is that they are help facilitate social relations. If you ever find yourself eating from a food stand or a food truck, you see that you elbow to elbow with the other customer. Usually a rule of thumb when going to other countries and where to eat on the street is if you see a food stand with a lot of people, it means that as it's a good source of food, as healthy, as delicious, most likely you're not gonna get sick from the food. So you are right on top of each other eating, and in some cases there's really strong connection between the customer and the business owner. In some cases, when there might be financial struggle by the customer, the vendor might loan them the food. That means that they will let them, they will give them the food, and then whenever the customer can pay for it, they come back and pay them. And sometimes it could be months before they can actually pay them, but there's that strong, connection that exists between the customer and the vendor. During the COVID years, it was really hard because some of the mandates shut down the entire city. The vendors could not, go and sell, and the customers could not come and buy the food. The other thing too is that if you some of the most cultural representative food, you go to a street food vendor. One of the worries that we have with Westernization and the Western diet is that they were going to come and essentially colonize the local cuisine, but that's not the case. You will see more of that in like brick and mortar businesses, but if you go to the streets, you see that some of the food, in the case of Mexico, you can still find tacos everywhere, tamales, all this the food that is traditional from that context. And the same thing for other countries and other regions of the world. The food is cultural representative. Now, on the other side, we have people who are not really in favor of street food businesses. Many of them see street food businesses as out of place, and my field planning and health in part responsible for that. When think about the informality nature of the businesses is something that some of these people on this side of the equation don't like, often because some of these businesses do not pay for permits to be on the streets. They don't pay for other services. Think about water, think about trash. And it represents an unfair advantage from the economic perspective of some of the brick and mortar businesses. Why are we paying for some of these services when our competition is not? So that's one of the challenges, the informality. Then we can think about poverty. Historically, street food stands have been linked to poverty. Like I mentioned, a lot of people from marginalized backgrounds participate either as vendors or customers. In some of our cities, that association, we don't want them on our cities because it's linked to that. We want our cities to be modern, to be have a different image to the world. And in some cases, that has been the reason behind some of the eradication of the street vendors, of the clearance of the streets. Now, from the this is more from the planning perspective. Vendors on the streets, when they take over either the roads or the sidewalks, they create some chaos. And you think about the modernization campaigns, you think about City Beautiful campaigns. The idea behind that is to be able to make our cities or streets as beautiful as possible to attract revenue from tourism. In the eyes of some of my planners, having streets that are cluttered with vendors doesn't seem as appealing. So that's, again, one of the reasons behind some of these eradication campaigns, the chaos, trying to bring order back into our cities or streets or public spaces. And overall, they're seen as undesired. If you compare a business that is on the street versus one that is in a nice brick and mortar business, often we favor some of these brick and mortar businesses. There's a lot of injustices that can be talked about when you think about this business. This is New York. In some cases, some cities, some governments, there might not be a legal pathway for some of the vendors to actually be part of the formal economy. In the case of New York, they cap the number of permits that they have, and the need for permits is much higher than what they offer. And the city knows. The city knows that. They take advantage of that because people still need to work. And New York City has a police task force that just go around the city finding for people who don't have legal permits to cite them, sometimes in the thousands of dollars. But again, in some cases, this business makes enough money that the vendors, expose themselves. They know they're gonna get cited, but they make enough money to pay back the citation and still make money for their families. So that's a clear injustice there. Another one is when you think about the desirability of the business. This is Nina Martin published this. It's based in Chicago. She talks about how in 2008, when we had the recession, a lot of the high-income gourmet chefs, they lost the businesses, the brick-and-mortar businesses, and they still needed to work and still to figure out how to generate income for themselves and for families. And they saw that street foods were a potential good source of income. They didn't have to, the startup capital to buy a food truck was much lower than having to have a brick and mortar businesses. But they also find out that the city of Chicago did not allow street food businesses anywhere in the city. So what they did, they rallied together, and with the high education, high income backgrounds, they were able to lobby the government, and within 2 years, they were able to change some of the zoning and land use ordinances to create permits for themselves. But when you think about who else was in the city, who else was advocating for the same type of changes, we have immigrant street vendors who for decades were trying to also change the policies in the city to allow them or to create a legal pathway that allowed them to officially, formally operate in the cities, but they were not allowed to. Even after the gourmet food trucks changed the policies, it was still favoring just the food trucks. And that's a paper. In this paper, Martin talks about, well, why are you, benefiting one but not the other? And it comes down to who the individuals were. On one side, you have immigrant street vendors who were selling out of things that we did not see as appealing, right? Push carts, maybe stands in the corners, versus the food trucks that now have become more like fusion food trucks that became more appealing for a younger population. And that was the argument from some of the stakeholder decision makers that were interviewed. The food trucks is what our community wants, not the push cars or anything else. And then on the other side, from the health perspective, often we have, there's a lot of research on the foodborne diseases, and with the objectives of making sure that food is not, doesn't represent risk for the community. But what some stakeholders or decision makers have, they have used these findings to say, hey, all these scientific papers are saying that street food is making people sick. Now we have an argument to be able to use in the eradication and removal of these vendors. And that wasn't what we're trying to do. We need to figure out ways to integrate them in our urban fabric, because a lot of people rely on the food, not just for food security, but income security. In other cases, after many cities around the planet have engaged in purification campaigns where they have removed a lot of the sidewalks, and they, in some cases, this is the case of Mexico City, they remove them and they have created these warehouses, these indoor markets with little kiosks or islands where they can continue to do the business. And yes, we are designing with justice and equity and inclusion in mind, but we also have to consider that some of these new indoor markets, they sometimes are miles away from the original location of the vendors. Some of these vendors use strategic locations. They are outside work sites, schools, or other places with high foot traffic. And when you remove them miles away, the original customers are not going to travel that, especially when they only have a few minutes or maybe half an hour for a quick lunch break. They're not going to walk all the way to the new location. So in the process, even though it was designed with justice in mind, all these vendors have to essentially start all over. And just to have a new wave of street vendors take over the original locations, because it's a process that goes back and forward. They get removed, and then either the same ones or new ones come, and they set up this location in the same place as before. Like I mentioned, this review is part of my ongoing research. I have already published a few papers on street food vendors. They all focus on Mexico City, and one of them might develop an assessment tool to be able to find or methods to be able to find the street vendors. Due to the high informality of the business, it's extremely hard to come up with a representative sample, because we never know how many there are, where they are. So here are methods to be able to find them. I also developed the first assessment tool that was focused on, once we found the vendors, being able to document what they're selling. That was the first tool at the time. Now I just recently reviewed a paper that were coming with a second tool. So a little bit of competition, which is good, because now they have two to choose from. All good here. And my literature review is not the first one. There's This one is 2018. It was a scoping review. And the key things to highlight here is that you can see that most of the papers have been done recently. Most of them tend to focus on Asian and African countries. And out of the different topics, most of them focus on food safety only. There's very few that have talked about food availability and consumption. And even a less number I'm going to show that talks about actual health outcomes. Another paper that did focus on the diet, another review that focused on diets, it was done in 2012, but this only included developing countries, whatever definition that is for them. But we know that in high-income countries, we also have street foods. It's just a matter that we like to pretend that they don't exist, but we have them. If you come to South Phoenix, I invite you to lunch. We have I know some really good ones and some that are sporadic, and sometimes I get frustrated because I cannot find them when I'm hungry. But we have them here. If you go to LA and some of the Latinx communities, we have them, right? They're here, but we like to pretend that they're not. So this study is limited in that they do not include studies or settings from high-income countries. So I want to know what is the contribution of street food businesses to the food environment, and how do street foods and beverages impact consumption and dietary health outcomes. It's a systematic review. We include some of these terms here: street food stands, sidewalk vendors, focus on nutrition, availability, but also on some of the health indicators like BMI, body weight, among others. We had an open time frame. We wanted to include everything that has published up to, we finished this in 2022. And we look at the traditional databases, PubMed, Medline, but we also included international databases, Cielo and Redalec. We included peer-reviewed studies that were published in English, Spanish, Portuguese. I do not speak Portuguese, my collaborator does. They had to be observational studies, and that documented or assessed availability, and they also evaluate associations between street food and beverages consumption and dietary health outcomes. We exclude articles that were non-ready-to-eat foods. I know I have a picture of a produce stand at the beginning, but that was excluded. Why? Because a lot of the produce stands, they're not meant to consume right there. You still have to take them home and process them. Sure, you can buy an apple and a mango, I love mangoes, and eat it as you walk, but they're not meant for street consumption. If you want that, you can go to one of the stands that we have where all they do is peel the vegetables and do a fruit cocktail. That's a food stand as part of the definition of street foods, but not the produce. Also excluded food studies that combine food away from home venues, so that included fast food restaurants with street food stands, and they did not desegregate the findings. It was just an overall results. Excluded interventions, cross-sectional case control studies that focus on tourism, foodborne contamination, and sanitation, because there's plenty of those already, or reviews for that, and also books, reports, and thesis and dissertation. The research team composed of three of us with background in nutrition, public health, global health. We divided the databases among the three of us and then independently searched. When it came down to, we store everything in EndNote. If you are interested in doing systematic reviews and how to be more efficient with it, I can share some of the resources that I have on how to be able to manage all this data that you get with it through EndNote. We followed the Prisma guidelines. Whoever developed this, they're geniuses. You look at the citation scores, oh my God, that's a lot. I'm jealous about it, but we use that so they get one more citation from us. The team, we first divided into couples. So that was again to be able to talk about what does this article get included on that. If there was a tie, then the third member comes in, breaks tie. The first screening level was the title and the abstract. After that, we moved to the full article, and then screen of the ones that were included. We screen the reference section to see if we miss any other articles. Data extraction, we focus on study characteristics, but also on the study design. So the type of study, when the collection methods, dietary aspects like info availability. Then we use Excel to be able to organize that. And we divided the findings into 7 categories, overarching categories. One was the spatial distribution of street food stands. So where are they in the city? The street food consumption frequency, the availability of street foods and beverages, the characteristics of the food that they were selling, and other correlates to food consumption and purchasing. And then we also focus on the health outcomes, which is the main thing we want to talk about. And then we also look into factors that were associated with street food consumption. The results, so these are pictures from my field work. We found on the first, through the databases of over 10,000 articles. After we got rid of the duplicates, we still were left with about 4,000 of them. At that, we excluded most of them, over 3,600 at the title level for different reasons. Then after that, we came down to 364. And then at the end, we assessed 100 of them. This is the breakdown, just confirming what the others have found. Most of them have been published recently. Most of them are in middle income countries. The majority of them focus on the customers. There's also something to say about the focusing on the vendors and who they are, and which is something I haven't done in my previous studies. The population, the most primarily adults. And then when you think about gender, most of them were mixed. And then population was also spread across. Same in agreement with the, I think has changed since 2018, although there's been a lot more studies recently, primarily focused on foreign-born diseases still. Most of them are still primarily found in Asian and African settings. We did not find a single longitudinal study. Most of them, all of them were cross-sectional in nature. Most of them were convenience sample, again, because of the informality of the business. It's really hard to be able to find them and have a convenience sample. We often find use points of access like work sites, schools, parks as a point of recruitment, like what's around them. The unit analysis, primarily the person. And here are some of the methods that they use for food intake, 24-hour calls, food frequency questionnaires, for food availability, primarily focused on observational methodology. Most of the way methods were not validated. When they assess the stand itself, it was also based on field observations. Most of the studies did not say what tool they used, if it was validated, or how they went about it. Now, with the spatial distribution, 14 studies focus primarily on this. Some of the main observations is the challenge in selecting the representative sample. Again, due to the informalized nature of the businesses, in some cases, families might have a need to sell food for maybe a couple days if they're in economic trouble. So they go to the streets, they be selling things for maybe a few days, a week, a month, and then they don't come back because now they're economically stable. When the New York Times published an article during the COVID pandemic about New York City and how a lot of the people who lost their jobs during COVID, they took onto the streets to be able to sell whatever they could. And that was a challenge because the people who were sellers prior to COVID, now they had to more competition. In some cases, it was their friends or family members who needed to sell food. And like, well, how can I coach or help them when they represent competition for me? Some of the vendors were found in strategic locations. The main ones were schools, work sites, transportation centers, again, places with high foot traffic. And we found mixed results. In some areas, there was a higher prevalence in low-income neighborhoods. In some other studies, there was a higher prevalence in middle to high-income neighborhoods. In my studies in Mexico City, most of the food stands can be found in middle-income neighborhoods. The consumption frequency, most of the studies were done in low to middle-income countries. 5 studies focused on children, 2 on mixed populations. The key observations here is that among adults, more than 50% consume street food regularly. And this is like kind of like a weird way to measure because they ask more than once a month, and that seems like, well, regularly, but it's just, how often specifically, and this is a limitation of the way that the original researchers were asking the question. And among children, the consumption was lower than that of adults, and that's because often children have more protection. So there's maybe regulations that don't allow the vendors to be near schools. And so that's one of the factors. For the availability, the key observation is that the food that they offer varies a lot. And this represented quite a challenge for putting this paper together because researchers were using all sorts of techniques and methods to report what they found. In some cases, they were talking about distinct individual items, so either a mango, a cucumber. In other cases, they were talking about food groups. So they had like fruit category that had mangoes, apples, oranges, and so on. In other cases, the more challenging one was when they reported the food in terms of dish or meal. So for example, tacos. I mean, I'm Mexican and I know what taco is, what might be going to taco, the tortilla, carbs, the meat, protein, and then veggies and whatnot. But other things from other countries, like I had no idea to even know what it's in it. You had to do a more deep investigation on what's in that specific dish. The food offerings, it was also quite complex. Some of the stands, maybe it's only so one item, coffee stand, pan dulce stand. Others have to 13 different items. The candy stand, in some cases, because of the different individual tiny smaller items, gum, hard candy, lollipop, whatever, they can have hundreds of different options. And in other cases, there will be also, if you think about a curry, in some cases there are up to 30 different varieties of the curry item in one stand, so quite complex. And main thing we also found is the offerings are cultural relevant. So we found tacos in Mexico, chapati in Kenya, panelle in Italy. So very cultural representative. Something that we try to do to summarize the what they were selling or available, we use Qualtrics to just put together, just dump all the way that the investigators were reporting their findings. And when things were not combined by category, you see that fried fruit and snacks seems to be like the main words that they were using. But then when we combine them, you see that now vegetables and fruits are the main ones. You used to see things that we don't necessarily want people to be consuming a lot of, like sugar-sweetened beverages, but this is kind of like you'll get kind of like seeing what it's out there. The nutritional characteristics, 40 studies talk about this. Some of them report micronutrients. Some of them focus on energy contribution. Some of the papers did laboratory analysis where they purchased some of the food and they took it to the lab to be able to get down to the micro levels. And then think about nutritional contribution. It's also complex. In one stand, you can find very healthy food options, like the person selling just fruits and vegetables. In others, it could be less healthy options. So you have a mix of ultra-processed items, snacks with some of the healthy food. So it's hard to just designate a food stand or this type of business as just unhealthy, which is something that some researchers have done, but it's quite complex. Among adults, the energy contribution ranges from 18 to 59%. And this is in the case of countries like Mexico City, is really important. You think about a day laborer who maybe only has the opportunity to have breakfast and they don't get to eat the rest of the day. I put this picture here too because it's person selling tamales. And if you haven't gone to Mexico, some of these vendors sell an item called a guajolota, which is a sandwich, and it's a piece of bread. And inside the bread, they put the tamal. And the tamal is made of carbs. So you're eating carbs on carbs. And then you can't miss your delicious atole, which is flour-based, which is more carbs. So that I tried to eat one, and I kid you not, I could only eat like a quarter of it because my stomach could not handle the rest of it. Because I was also drinking the tamal and it was a big cup. But for some of these day laborers, that's the main source of food in the morning. And that when I ate that quarter of a guajolota, I did not feel hungry until like dinner time. And that's why you consider like the significance of some of these stands for the people who work there. Main source of energy for some of them. Now, health outcomes. Of the 100 papers, only 7 of them talk about health outcomes. Most of them focus on weight as the main measurement. And we know that that can be biased because studies were self-reported. So sometimes we tend to report less weight than we actually weight. And like here, 7 of them focus on children, on adults or on children. When think about cardiovascular risk, only 4 studies assess that. And then the relationship between street food and beverages consumption and health outcomes is still inconclusive. And some studies they found a positive association for adults and children with in terms with weight. And other ones they found a negative association in one adult sample. That doesn't mean that after the meeting, because it's almost lunchtime, that you're gonna go and buy as many tacos and eat as many tacos as you want, just because we found that there's no association, right? Because actually one of the studies found that the more tacos you ate, the lower your weight measurement was, which was interesting. I mean, also depends on what kind of taco. If it's carnitas, you're not gonna see that association for sure. And then for the cardiovascular risk, it was a positive relationship in 2 adult samples and no association in 2 other samples. So very inconclusive. Almost towards the finish line here. So thinking about public health and policy implications, it's not just a black and white or healthy and unhealthy simple matter. Like I mentioned, some of the stands are quite complex. You know, depending on who you are and what you want for a meal, you might go, have a snack with the frutero, the person selling just the cut up fruits, mangoes, and the cup are super healthy. You want a smoothie, go to the smoothie stand, add some protein, some cereal. That's healthy. But you might end up going to the person selling the carnitas with the, carnitas high in fat, and that's not as healthy. Or maybe you just want to go and buy candy. So it's quite complex. And some of the stands are selling everything in one stand. So it's not just black and white. We had to do a more in-depth investigation and to be able to classify them. There's one paper that did talk about nutrition interventions. They did street food fortification. So they added, they fortified some of the meals and curry, some of the broth. And that's something that we could potentially do. Instead of maybe focusing on just removing all the vendors, can we use the vendors to, for instance, put them in locations that might be underserved, that might be low income, low access communities, food deserts, as another term for that, and maybe increase access to healthy food. And this is something that the city of New York did many years ago. They had this green card permit where they knew, because they know that there's people who want to have a permit, they increased the number of permits with a catch that they had to sell healthy food in underserved communities. And years later, they evaluated that policy or that initiative, and they found that for the most part, it helped bring healthy food to these communities. But they also noticed that some of these vendors were also selling things like cookies and chips, which is not so healthy. But we can also, think about regulation of street foods and beverages, not just in removing them from the street, but like making sure that they're selling food that tend to be the healthiest for community members. But there's also many opportunities for research, and this is kind of like what and I SIRC and helping me put together a proposal to now see what could be the long-term impact of consuming street food. So stay tuned for that. And the recommendations for future street food and beverages studies. We have, like I mentioned, it was challenging to put the report together. So we came up with some ideas on how to think better for future researchers. So first, include a representative sample of the businesses. If you only focus on what's around for say a school, you're limiting your observations and results to just the school for environment. And what I've tried to do in previous studies was to figure out methodology that's able to assess a larger context, a larger setting. We also need to focus on using validated assessment tools that can facilitate the measurements of the availability and also the nutrition quality of the assessments. Like I mentioned, prior to my studies, there was not a single tool. We have other ones to measure restaurants, supermarkets, convenience stores, but there was nothing specific to street food stands. We also need to figure out a way to standardize food reporting methodologies. Like I mentioned, we are all over the place, reporting macro, micro, energy consumption, meals, dishes, individual items. We need to figure out how to have one way to do that. And then combining dietary intake, so some of those 24-hour questionnaire, food frequency questionnaires with actual observation assessments. There's been some studies where they ask the individual, hey, do you eat street food? And say yes or no, and then ask, what type of foods do you eat? How often? But that's just relying on the participants. They don't go back and confirm that if they say that I live in this community, that those type of food stands or food banks are actually there. That's one of the limitations. And then there's a need for longitudinal studies and adjusted for confounders. And that's part of what I'm trying to do next, look at a year-long study, but also consider what other dietary patterns people have, because if they're in a street food stands, probably they're also eating fast food restaurants or other places. So how can we account for that in the assessment of the relationship between dietary intake and street food stands? But yeah, thank you. Thank you so much for your time. This literature review is right now under review in obesity review. So hopefully we'll get good feedback to continue to improve and hopefully get published soon. But yeah, questions, anybody? Let me tap the share.
Well, first, Jose-Benito, great job. Really interesting. I'm mad at myself for placing this talk right before lunch because I'm really hungry now.
Yeah.
I want to open it up for questions. You feel free to put it in the chat and I'm happy to read it. Or take yourself off mute and raise your hand. I also want to let everyone know that this will be posted on our SIRC website, which is circ.asu.edu. Hopefully within the next couple of days. Comments for Dr. Rosales Chavez? Dr. Vega Lopez.
Hi, thank you for your presentation, Jose. Really interesting. And you brought me back to Mexico City as well. So that was an additional benefit, even though I also got hungry from your presentation. Not necessarily for guajolotas, but
Yeah. It's not time anymore. It's already known. We need to find tacos.
I'm wondering if with the articles that you found, there is any information about the geographic location of these stands. I'm not familiar with what happens in other countries, but certainly in Mexico City, you see them more like close to either transportation hubs, but another place where they're often located is near schools, and that's usually of concern because even when you're finding that there is availability of fruits and vegetables, what you see sold around schools is not necessarily those choices and those options. So I'm just curious if there's any more information that has been documented more systematically about where these food vendors are.
Yeah, so and that's one, like I mentioned, one of the challenges with street foods research. Most of the papers have focused on convenience samples where they target schools or work sites. And what I tried to do in one of my earlier papers is, well, we know that they're on the streets, and we don't want to be limited to just a specific point of access. We want to span it through the whole city. And in that previous paper, we did 20 neighborhoods all the way from the north point to the south, east, and west of the city, across income levels, and we use street segments as the point of recruitment. So we evaluated the segments to see where they are, and as part of the segment evaluation, we assess, okay, there's a food stand here, what's around it? Are there hospitals, work sites? Are there malls, parks, schools? Because that will give us an idea of who the vendor are targeting as customers. And some of the things that we found was transportation centers, one of the top ones. We found work sites, and that include anything from hospitals, corporations as the second one. Homes too, but I mean, if you're not familiar with the context of Mexico City, it's highly urbanized, a lot of high-rise apartments. In some cases, there might be businesses on bottom and residential on the top. So in some cases, you couldn't tell if it was a business or a residential complex. That has to be taken with grain of caution, but we tried to do that to see where across the city they are. And one of the hypotheses we had coming in is that we're going to find most of them in low-income communities, marginalized communities. If you're not familiar with Mexican context, downtown Mexico City is the high income, like the richest areas of Mexico. And then the periphery is a contrast to American cities, where there's periphery here, we see like suburbs. Not the case in Mexico. That's where the most marginalized low-income communities are. And that's what we thought we were going to find the most. And surprisingly, it wasn't. It was middle income with the highest, then high income. And because I did not recruit the customers themselves or the vendors, it was more like the stand. We think that because a lot of the work sites are in downtown Mexico City, a lot of people from the periphery travel to work. And that's why you have a need for the food stands to be in those locations. In other countries, a few that did special analysis also found transportation centers and schools as some of the areas where the vendors tend to congregate. But because the main thing they're trying to do is set up their shop or the stand where there's high foot traffic. So wherever you find people walking, that's where they're going to be. And they varies across the time of the day too. We did that across the times of the day. That's where I said that tamales are on in the morning, and then at afternoon, there's another group of vendors who come in. Then at night, there's another set of groups. Some of them are there the whole day, but it varies across the day too. Which is something that you don't really see here in the United States, and that's another paper that I'm working on right now. So like it can be related to planning and regulations that we have, that we regulate the heck out of everything, and well, even from where someone can be that hinders. If you look at the City of Phoenix regulations, food stands like the ones I study can only be in downtown Phoenix. As far as I remember, I think they might change, but I remember there's a food. I remember seeing a hot dog stand right outside the court. And I think that falls within the downtown. Outside of that, we have the food trucks that can be either street vendors, I think, and I can't remember the differences, and then mobile vendors. One of them, you can be in one location as long as they have permit from the business owners or like a parking lot. The other one, like ice cream trucks, they have to be moving constantly. They cannot be stopped or permanently parked in one locations.
Yeah, we also have a lot of regulations related to food safety, especially here in the area because of the weather, which may not necessarily be the case in other places.
Oh yeah. If you go to Mexico City, you see my wife was really weirded out about like people selling meat on the markets. There's no refrigeration at all. They just have the meat on the stand. They just cover it with a piece of rag, scare the flies away, and that's how. I mean, we do have a really strong microbiome system, but that's how people. That's the norm. And here in the U.S., you will never see that. But thank you for your question.
Well, and you kind of touched on where my brain was going was when within the Phoenix or Maricopa County context, the idea of food trucks versus street vendors, and you kind of talked about that.
Yeah.
But I'm curious about how you see potentially Maricopa County or Arizona being able to use street vendors to address food insecurity or food deserts, and is that at more of a policy level, or is that more at a neighborhood community level? And then
But
what
I
are
think
your
this,
thoughts on that?
yeah, I think it's hard because I mean, we think about the example of the green cards in New York. That was an initiative that they did, and it partially accomplished what they wanted to do, which is bringing healthy, nutritious food to some of the communities that are struggling to get access to that food. Uh, and in that case, it came from the city of New York, and it was regulated, so they had that. But also, it's like, do we really want to regulate as much as we can some of these vendors? I talked to some of the vendors and they don't want to be regulated. They want to be able to do the business without having to worry about the regulations, because some cases is just the fact that you have to apply for a permit, that it costs you money, that discourages some people from being part of that formal economy. And so they do it informally. In other cases, if you, have another project that is kind of like is focused on home businesses and the food that they cook. You remember the tamale bill that was vetoed recently, and all the news that are attracted that people, there are people in the communities are also engaged in this activity informally. They're cooking food, they're selling food, and they want to have the opportunity to be part of the economy legally. But because of the policies, we talk about food here in Arizona, you have to get a permit from, I think, and someone from the city may correct me, you have to get a permit from the city where you are working or you're going to be traveling to. So if you have a food stand, if you move to Phoenix, then you go to Tempe, I think you have to have a permit from each city. And on top of that, I think you also have to have the permit from the Maricopa County Environmental Agency. I think that might have to do with disposing of the food or the waste. So you have to get a permit from that too. So there's different layers that you have to navigate. But ideally, one of the ideas would be, can we bring some of these places of type of food venues to low income, low access food desert communities to be able to increase access to healthy food? Because often we focus on supermarkets, but we know that there's research that I have found that they don't work. Like, you open a new business, it takes a lot of tax money, incentives to get the business there, might not generate enough profit, and they take off, and then they leave the community back to how they were. So, and the advantage of this is the mobility. One day, and I talk about tianguis briefly, the street markets. In Mexico, this street markets is a group of street vendors that get together, they make an alliance, and then they have permits, they're formalized, and they move from one street segment to another. So Monday, you might find them in rural and a street in, I don't know, like Mill to the intersect, yes. And then the next one, you maybe in McClinton and some other street, they're always moving together. And there's like up to 100 vendors providing multiple options for different prices for fruits and vegetables, cooked meals, and other goods. And they're always traveling together. And that's something that could be implemented here. I mean, it happens in other countries, but again, like, they come to you, right? When I was in Mexico, I could just, when I know when the mercado tianguis was coming, I would just go walk 5 minutes, get the food, come back, and it was there. And that's in addition to all their brick and mortar businesses. But that's the idea. But I think if first I want to have a better idea of what's the impact on health outcomes. Because I mean, my goal is to promote them, but at the same time, if they're having a negative impact. What can we do to change that?
We have a question in the chat. Do you see the updates to cottage food regulations affecting affecting the street food landscape in the Phoenix area, or affecting the perceptions of street food here?
Yeah, and then I think this is something that I was trying to get more familiar with, because from my understanding, college foods regulations were for people who are cooking from home and maybe going to farmers markets to sell food. But I think that might be a different concept than the actual street food business themselves. So I think that has two different phenomena, if I might call it that way. But I think if there were to be more positive regulations for that and facilitate people being able to cook from home and then sell it, my understanding is that some of these cottage food vendors or people who are part of this program, they often partner up with other businesses like restaurants or maybe hotels or farmers markets, and they cook from home and then they sell the item to them and then they sell to other people. Maybe if there were more friendly policies, I guess they could then potentially have their own business on the street, but then that also has to come with changes to regulations. So for instance, if you think about food trucks, right now the policies don't allow them to be necessarily in residential areas. They have to be primarily commercial and what's the one? Industrial areas, and not so much in residential. I don't think they can even go to parks where people might go and spend the day. So I think that you have to couple them with other regulations. It's more like a holistic perspective. But I think the cottage foods program could be a good way to potentially open the doors to other regulations. But yeah, and the perception of street food, I mean, it depends on, I guess, who you're talking to. I think you talk to Latino community members, they could be more friendly because we have experience with them, especially we came from Mexico. We know that that's part of our food environment. I know friends who that might be afraid of going to a food stand. They may even be afraid to go, like there's something like a hole in the wall restaurants that, they're not gonna make you sick, but because of how it looks, people do not have an appeal to go. So it just depends on who the person is and what is it that they're looking for a source of food.
All right. Any last question that anyone has?
I have one more question. My name's Roy. I work
Yes.
at AZ Health Zone. An amazing presentation. Sorry, my screen is here, but then the camera is right here. I thought it was a great presentation. It sounds like there's just a lot because I grew up in West Phoenix and I've grown up in Arizona, and then the demographic trends are telling us that Arizona is going to be a Latino majority state by next year. I walk like every morning, I live in downtown Phoenix. I grew up in West Phoenix. I was in West Phoenix now, and where they're building all the new apartments and houses, there's tons of stuff there. And every morning I walk from like my house in like Roosevelt all the way down to past ASU downtown, and there's like a senora with the truck, and then she sells like 3 burritos for $10. And all this stuff is just, in my opinion, has just been so well received by the community because you said it is going to become, there's going to be more people that are, I feel like, find this normal and don't even think about regulatory environments and these things. So it feels to me like the landscape is that the policy is just so behind the evolving culture of Phoenix. And it's going to take like a lot of work from a lot of different parties to reach an understanding, because if we want to be the true reality is people like this stuff and it's so part of Arizona culture, because this is very much like the community members.
Yeah, you bring a really good point. If you think, I think one of the best case study samples is Portland, where the local government encourages street food businesses. They create pods of businesses where you can walk on the streets and you find them, and it has benefits. Not just thinking about food security and economic security, but there's this other concept of eyes on the street. Do you prefer a street that is dead and at nighttime you might be afraid of walking, or a street that has vendors and it's alive, right? And that's what the city of Portland focuses on, like, let's, give life to our streets. But in a highly regulated environments like Phoenix, that's not happening. And I agree with you. We are behind some of these policies, and it will take different changes across different levels. You think about LA, where or California in general, and LA specifically, where street food vending was completely illegal, but there were still people doing it. And in some cases, those people were harassed and killed by other community members who did not have a good perception of them. And if you're a street food vendor, how can you go to the police and say, "Hey, I was doing my business selling, and oh, you were selling illegally? All right, let's go get you," right? How can you create that trust with the local politicians or governments when you're being penalized for just existing, and when you don't have the opportunity to become formalized, legalized? The city recently, not that recently, 2-3 years ago, changed their standing, and they legalized street food vending at first in specific areas, and now all over cities. Like in LA, you can sell food anywhere now. You couldn't sell food near the beaches, essentially where the businesses. You couldn't go to their no sporting venues, concert venues, not near the beach, not near the parks or wall. And now they changed that. I was in San Diego recently. I did my undergraduate in San Diego, and back in between 2007 2012, there were not any vendors on the near the beach walkway. Went back last year, and then there were hot dog stands and all these other people selling food right on the walkway, a few meters away from the beach, from the water, the ocean, and that's because of the policy changes in the policy.
Well, we are out of time.
Well, thank you,
First-
everybody. Great
Yes,
discussion.
first, Jose-Benito, thank you. That was a fabulous presentation. I really learned a lot. And thank you all for joining us today. Stay tuned for our next SIRC Health Equity Lecture Series. And if there's anyone that you're really interested in hearing talk, please let me know. I'm happy to reach out to them as well. And Jose-Benito, stay on for 1 more minute after we end our recording.
Yeah.
Thank you all.
Thank you, everybody.